So I'm going to talk about geographic information systems and GeoHealth. I'm in the Department of Geography, and I'm also director of the GeoHealth Laboratory. And the GeoHealth Laboratory uses geographic information systems, I'll tell you what that is in a minute, to do research for the Ministry of Health. And they fund us. They pay for 3 full-time researchers, 2 at the university and 1 in Wellington at the Ministry of Health, but employed by us, paid by them, slightly confusingly. And we've been going for nearly 10 years, 10 years coming up. So obviously the Ministry of Health thinks it's valuable because they pay us a reasonable amount of money to do research for them. So I'll tell you first what GIS is. GIS is a technology used to view and analyse data from a geographical perspective. In essence, it's a series of maps, the ability to layer maps on top of each other and ask questions of them. So if you imagine you've got a map on land usage, elevation, parcels of land, streets and people, you can ask questions through all of them. The step beyond that is GI science. So some people talk about GIS standing for GI science, and that is the ability to use GIS to actually add into that spatial statistics. So our GIS students really have to understand statistics as well. So it's then using the combination of the spatial statistics and GIS to answer research questions. These are the sorts of uses, the sorts of things people do with GIS now. So there's a whole range of stuff. Some of them are overtly science, some of them aren't, but the police use it for crime mapping. Sport now, they track athletes. So they use GPS to track how their rugby players do it. They see how fast and how much of the pitch they're covering. Resource management, census data, hydrology, wastewater, transport, etc. And I'm going to talk about a study that's about to happen in Christchurch using GIS in terms of rebuilding the city as well. So it's used in a whole range of things. In terms of jobs and government, we actually have a government which really should be called the Department of GIS, but it's called Land Information New Zealand. Really, they are in charge of, as they put it, the power of where location has the power to unlock the potential of so much other information. So LINZ are now developing a geospatial strategy. They reckon it can add value of over $1 billion a year to the New Zealand economy because we're not using geospatial information that's attached to pretty much everything that we have. So there's a whole department of it. If you go and look on other departments' websites, you soon start seeing the importance of GIS. So CERA have a whole set of maps. They are produced by GIS. Some of them are produced by our ex-graduates or ex-employees who now work there. I go in occasionally to CERA and they're all my ex-students doing the GIS mapping. Department of Conservation have a whole page. And if you go onto the homepage of ECAN, then you can see there's a whole area dedicated to GIS mapping. And so all their information is stored in GIS. So it's used a lot. In terms of careers, I just looked on Monday to see how many jobs there were at the moment, and you can start pulling up quite a number of jobs. This is using Seek, a whole range in New Zealand. You get a whole bunch more in Australia. So there's heaps of jobs. To the extent that if you go to this careers website, it says the chances of getting a job in geospatial specialist are good. It talks about how many people are doing the job at the moment. So there's 2,000 estimated. But perhaps the bit that really tells you how much and medical physics is saying the same, how much of a skill shortage we are, is if you look down the bottom, it says because of this there are not enough people training in the area at present, and it is now on Immigration New Zealand's long-term skill shortage list. And so it went on in 2013, and what it means is that when we advertise jobs, and we've got a job at the moment for someone to do GIS in the department, we get nearly all our applicants are from overseas because we're not producing enough people, and when they have to apply for visas, they get done in about a week. So they see the word GIS, they check they've got the qualifications and they get through. So we employed a guy last year, he came from the UK, and we couldn't believe it when he said I've got my visa, and it was within a week of us offering him the job. We are trying to, so we now have a master's that we set up here at Canterbury. It's taught with Victoria University in Wellington and AUT, but it was set up here and most of the people who teach it are down here. And we are now trying to train more people because there is such a growing demand for it. What's GeoHealth? GeoHealth broadly is the geography of health. So it's looking at diseases and health things in the context of geography. But that can include some more qualitative stuff. So it can include stuff related to interviews and things. But the way we look at it, we use it in the context of linking GIS and health. And really what it is, it's linking health outcomes and environmental and socioeconomic data for studying population characteristics. And there's 2 main ways it's used in most countries, in this country certainly. And that is in terms of working out where to put health services and looking at demand and need for them. And the second is looking at spatial distributions of diseases and understanding what are the causes of those, or understanding what are the things that are relating to it. So they're the kind of 2 main things, and I guess they're the 2 main areas that we do research at the moment. So it's where should we put hospitals and doctors, and how important is where you live in relation to where the services are in terms of how much you're going to use them and what barrier is distance to things. And why are people ill in certain places? And if we can improve the places, we can actually stop them having to go to the medical physicist because they won't need x-rays, because they won't get sick in the first place. So a lot of it is health prevention. So this is saying where's the best place to put the medical physicists and others and the speech and language therapists. And the second part is saying, look, how do we actually make it so people can live healthier lifestyles by working out what the determinants of poor health are? And the reason health is really a good thing to use GIS for is because 90% of health data has a spatial component. So we either know where the hospital is, or we know where the patient is, or where they live. And increasingly, we're starting to understand more about where people are moving around. So it's not just home location. District health boards have boundaries, and the census data has boundaries, and we can use all that information. And so we then do what GIS is, and these are the sort of layers you may get. So you have a digital elevation model looking at how high and the topography. District health board zones, you can then put on roads, and then you have information about people. And you can start asking some questions of all that information to determine what's causing people to be ill or to be well. So it's not just illness. We've actually done some research on where in New Zealand are people healthier than you'd expect. And if you can understand that, you can start saying what are the characteristics of that area that allow you to then learn and apply that to other people. One of the first things that people actually like, so when you talk to people in the ministry, they say we just want some maps. So actually visualizing data. And these are sort of examples of the way you can visualize data. And producing this is relatively straightforward. So if you want to be able to produce maps like this and you've got the right data, then you can take our second year paper. We have a second year paper in GIS, which is open to all students in science. It's not just geographers. A lot of geologists, forestry students take it, a lot of biologists take it. And then you can just do this sort of thing. Now that really is just a way of just producing pretty maps. So actually what we really want to do is train people up so they can do things a bit more advanced than that. So I'm just going to give you a whistle-stop tour through some projects that we've done in the GeoHealth lab over the last few years. So we did one looking at schools and fast food outlets, and that got a bit of publicity because what it concludes, not surprisingly, is that in the area of the lower decile schools there are more fast food outlets, and if you track it over time, the number of fast food outlets in the near the low decile schools has increased much faster than in the high decile schools. And it raises the question, should we license fast food outlets like we license alcohol outlets and like we control other things in our environment, so we control smoking because we know that people in low decile groups have worse health, etc. So that's one piece of work. Similarly, we've done some work on gambling. Does problem gambling behaviour related to the proximity of where people live in relation to gambling outlets? Now that might be changing because of the ability to gamble online, but this research looked at basically where people lived and where the outlets were for gambling and saying there's a relationship. And again, if there are, then we might want to start thinking about how many gambling places we allow. We've done quite a lot of research on green space, and we're still doing work on green space. And we're also looking at blue space. So how important is it living near a park? How important is it looking out the window and seeing nice greenery? Because we know that people in hospital they recover quicker if they have a view of a park. We increasingly know that if you live near a park, you have better health outcomes. There's different ways of doing it. So this top one up here is actually saying, look, is it just the amount of green space within a certain distance? So these are called buffers. Or is it actually how close it is to get to? And there's two mechanisms. One is it just that you can see it? Or is it that you actually go out and exercise? So there's different ways of doing this. It's not just a case of saying how far is green space. You actually have to work out how to measure the accessibility to green space. We've done quite a lot of research over the years on air quality and health. So does it matter, does the quality of the air actually within a city, does it matter where you actually live in relation to that? And so this map shows respiratory emission rates, and then you can relate it to pollution and start looking to see whether there's some links. We haven't done as much stuff on healthcare planning. We've done some research looking at what people do when they phone Healthline. Does it make a difference how far away they are from the hospital? So what we know when people phone Healthline is that most of the time they're told what to do and they ignore it. And what we want to know is, do they ignore it based on how far they are from the hospital? So they phone Healthline and say, oh, you're fine. Oh, I'll go to hospital because it's really close. Or you phone Healthline, you're told to go to hospital, but you live too far away, and therefore you say, well, I'm not going to go. So some of those sorts of things. But you have to understand how long it will take people. Is there a cut-off point at which distance it's too far for you to go to hospital? Those sorts of things. These are some other examples of these are mainly from the US, looking at proximity of facilities in terms of where people live. An increasing thing, this is where it's starting to move in terms of the research, and we're starting to use GPS technologies, is actually what about where you have lived over your entire life? So if you imagine each of these as an individual, and we've got two different risk factors and you say this is birth, and then after 20 years you move to this place, and so this is the vertical axis is time. So you're tracking people through the environment. This is actually an example from, I think this was based on Finland. But you can see that if you track people over time, you say, what is the lifetime exposure to a whole bunch of different things? And can you then identify which of these things is actually causing people to be ill? And the reason that's important to know is that we know that a lot of things have a very long latent period. So we might be exposed to something today that might make us really sick in 10 years' time. So we know that particularly applies. Things like smoking, you don't have a cigarette and fall down dead. You have a cigarette over a number of years and then it gets you later. But the same applies for a number of other things in the environment. So you might live on bad soils or whatever. And we're just getting into a project which you may have heard about called the Sensing City. Put a load of sensors around Christchurch when we rebuild it. We can collect loads of really interesting information and make our city a better place and us healthier. So we're involved with a project looking at COPD. That is chronic obstructive pulmonary disease. It's mainly people who smoked in later life who get very, very ill. And we know that if they use their inhalers, we can manage their health very well. And the medics we're working with say that the biggest predictor of someone with COPD going into hospital is them not using their inhaler as they're meant to. So the first part of this project is just monitoring when they use their inhalers. So we're going to track inhaler usage. So we're going to give people special inhalers that will tell us when they use them. But we also want to know where are they when they use them. We want to track people as they move around the city and say, does it make a difference when these people go out? And does it then make a difference in terms of the air quality? So if they're in a polluted part of the city, do they suddenly need to use their inhaler or suddenly go to hospital? So we're tracking people. This is going to be clever. Here's our friend Tony. Tony, as we all know, isn't a very happy man. 1 minute to see what happens to Tony. Here we go. So what we want to do is imagine this is a hypothetical man called Tony. How does his COPD condition alter as he moves through the city? So he's going to live here. So what we'll do is we'll see him move. And there he goes, and off Tony goes. And as he goes to the city, we can actually understand something about the air pollution because we have pollution information, and we can see when he uses his inhaler. And so we're actually tracking him. This project is just about to start. It's kind of, some of it's starting, but we're actually going to be doing the GPS bit, and we've got some money from the Swedish government and the Australian government. So that's even better about this project is the New Zealand government really isn't paying for it, someone else is. So that's a win-win. One final example of new ways people are starting to use geospatial technologies are things like Twitter. So you can produce maps of Twitter use, this is in Japan, and look at symptoms according to how people say they are feeling. So you can actually track information using Twitter. And there's all sorts of other ways of getting really interesting ways of identifying geography of health using Facebook, Twitter, and a whole bunch of other things. And we're just starting to get into some of these things and work out how it can be done. So that's a little bit on GeoHealth and GIS.